guys, what's up? My name is Maria Pontillo. I am a doctor of physical therapy, and today's tutorial is going to be on addressing trigger points. So trigger point is something that your patient will come in and say to you, I have this kink, I have this knot, I have this spasm, and mainly what it is a taut muscle that remains in a contracted position, and it actually alters your mechanics and range of motion, causing referred pain in other areas and altered movement patterns. So it's definitely something that needs to be addressed and worked out. So you can do it via regular assessment, palpation, feeling that tender lump or hardened tissue. Or a really good way to diagnose it is also using the graston tool. So what I'll do is have my patient go into a forward flexed, really rounded position. Make sure that they do this because you want it to be in the maximal stretch, so you can really assess where that trigger point can be. So I'm gonna look for gritty, more reddened areas. Okay, so I'm finding here at the rhomboid area, particularly right here up by the scapular border, definitely feeling that different gritty tissue versus up here. Okay, so I can continue to treat, spending a little more time on this area. Up to 4 minutes I would say would be enough. And then I'm going to have my patient go down into a prone position to really work. Essentially what's going to get the trigger point released will be deep tissue massage. And then I'm also going to talk a little bit about active release. All right, so the key about this is be aggressive. You want to provide a good amount of pressure, as much as they can tolerate. But a lot of times if you can just educate them on why you're using a lot of pressure and why, how this is going to help the trigger point, and you communicate with your patient, they'll allow you to be aggressive, if that makes sense. So I'm using the base of my palm to really keep a good amount of contact with that rhomboid area. And he's got, a lot of muscle. He's a bulkier guy, and a lot of athletes too, you'll fall into this situation. So I'll go ahead and just use my ulna, my elbow, my forearm, and just kind of really put a good amount of my body weight following that muscle pattern and fibers. And so, again, push through it, let it be, aggressive, communicate, talk to your patient. So, all right, do this for a good, there's no set time frame, but it's definitely not something you want to only do for a minute or whatnot. So definitely spend some time doing that. All right, then I'm going to do some active release. So I'm going to have my patient participate with me. And basically what I'm going to do is have him contract the rhomboids while I provide a pressure at that trigger point. So if you can see, I'm going to have my patient shorten the muscle by lifting the elbow up, and then I'm going to tap down that trigger point and then have him release to a lengthened position. And we're sort of just going to repeat this pattern over and over again. Okay, and let's just say maybe they don't, the active release isn't working. You can do it passively, so I can pull up, tap, and lengthen. Pull up, tap, and lengthen. All right, so again, the more feedback, the better that you can get from your patient will provide the best outcomes so that you know what to do in terms of adjusting your treatment style and whatnot. So hopefully this helps you in your future treatments, and I will be around again to teach you guys some more tutorials using cupping and some other treatment techniques. So thanks for sticking around, and I'll see you guys again. Bye!